Good morning, Dr. Anthony. Thank you for joining us for today's COVID-19 update for January 20th, 2022. Let's begin with some numbers. What's the current active cases?
So right now we have 12,355 active cases, and over the last 24 hours we would have done 2,541 tests, and of those tested we had 819 persons who have tested positive. So we do have a lot of active cases, and they're in all the regions.
Could you give us a regional breakdown now, please?
Right now in Region 1 we have 134 cases. In Region 2 we have 348 active cases. In Region 3 we have 1,935 active cases. Region 4, 7,512 active cases. Region 5, 388 cases. Region 6, 600 cases. Region 7, 269 cases. Region 8, 50 cases. Region 9, 365 cases. And Region 10, 754 cases. In some places, like in Region 10, where the numbers are relatively low, this is not because they have less cases. I would think that it is because they haven't done enough testing. So I'm sure once we are able to do more testing in that region, we'll certainly find more cases.
Okay, what about vaccination?
In terms of vaccination, we continue to see a steady increase. And right now for first dose adults, we would have completed 419,509 persons. That's about 81.8% of our adult population getting a first dose vaccine. But if you want to fight Omicron, it's not just first dose vaccine. You got to get second dose, and you also have to get your booster dose. So for second dose, we have 306,831 persons receiving their second dose. That's 59.8% of the adult population. In terms of the 12 to 17 age group, we have 32,040 persons who would have received their first dose. That's 43.9% of that age cohort. And for second dose, we have 22,565. That's about 30.9% of the age cohort, second dose. So again, there's still a lot of room here for improvement in terms of children getting vaccinated. Booster doses, we are now at 31,124 persons would have received their booster doses.
Okay. Any word on hospitalization?
In terms of hospitalization, we have 145 people right now in hospitals. 105 of them are at the Ocean View Hospital, and of those that are at Ocean View, 16 of them are in the ICU.
Okay. Dr. Anthony, you mentioned earlier that for the last 24 hours we had like 2,541 tests, and this has been a daily occurrence, between 2,000 to 3,000 tests daily. For January, how many tests have we conducted so far?
So in January so far, we would have completed 55,429 tests. But to put that number into perspective, if we go back to 2020, for the whole of 2020, so we had our first case of COVID starting on the 11th of March 2020. So for the whole of 2020, we as a country did 38,548 tests. This month alone, and the month is not completed as yet, we would have completed 55,429 429 tests. If we look at the tests that we did for 2021, we would have done 387,266 tests overall. That, on average, would be about 32,272 tests per month. So you can see in January of this year, we would have exceeded all of those numbers in terms of testing. So we have been testing quite a lot. More people are coming out to be tested. And we'll continue to do that. However, we have to make sure that we are using our testing resources properly and that we are targeting the population who really need to be tested. So persons who are symptomatic, if they come to our testing facility, we are going to test them with the antigen. If they're positive on antigen, we are not going to repeat PCR as was previously done. So this here, once you tested positive, that's it. And for PCR, we are putting that for the patients, prioritizing that for patients who really need to be checked with PCR. Those include the people who are in hospital, persons who are coming to the accident and emergency or our outpatient departments, persons who are in high-risk setting, or any other person that one of the clinicians feel that they should be tested for COVID-19 using PCR. So this is very important because what we see is persons coming and clogging up the system, not having any symptoms, just believing that they should be tested, might not have been exposed, just coming to be tested to see if they're okay. And that is causing a lot of backlog in the system. So we don't want that to happen. If people are really need to be tested, we are going to do those tests. And as you know, in Georgetown, we have seen at the Umanayana, for example, a lot of people have been flocking there. But I want to advise them that we have about 8 or 9 health centers in Georgetown, different parts of Georgetown, that are doing antigen testing. So you don't have to go to just one site. You have health centers in your community that are able to do antigen testing. So please go to those health centers that are nearest to you and you can get your antigen testing done there instead of coming to one place and clogging up that one site.
Okay, Minister, there's a question here about an outbreak of COVID-19 in specifically region Mabaruma in region 1. Could you confirm if this is true or not?
Well, I wouldn't say there's an outbreak in region 1. In region 1, as far as I'm aware, we have 134 cases, and of those 134 cases, 41 of those cases are in the Mabaruma area. But I wouldn't consider that to be an outbreak. In Region 3, for example, we have 1,935 cases. 198 is in Parfait Harmony. So I would say it's a hot spot. But to say that it's an outbreak, I wouldn't say that. It's a hot spot. A lot of people around there probably are mingling, they're socializing, they're not wearing masks, and therefore you would see these types of outbreaks. In Region 3, as I said, Parfait Harmony, you have 198 persons, that's a hot spot. Tushin, you have 122, that's a hot spot. Podrine, 82 people, again, a hot spot. Crane with 75. Good Fortune, 65 persons. iFlood, 63. CI, 60. Westminster, 53. Lagrange, 53. So you can see that there are a number of villages where we have a high number of cases. On the East Bank, for example, at Diamond, we have 248 cases. In Grove, 197 cases. In Eccles, 117 cases. In Herstelling, 109 cases. In Providence, 105 cases. In Mocha, 55 cases. Soesdijk, 44 cases. On the East Coast, Nomprel, 74 cases. Mondrepo, 62 cases. Better Hope, 60 cases. Haslington, 57 cases. Paradise, 50 cases. And, you know, so every village almost you have active cases. In Georgetown, in Kitty, we have 406 cases. In Sophia, 310 cases. In South Rhineville, 245 cases. In Camberville, 222 cases. Cummins Lodge, 220 cases. Lodge, 140 cases. West Rhineville, 138 cases. Turkine, 113 cases. So we have a number of hotspots. And again, I keep urging people that they need to wear their mask and take the precautions. A lot of people are seen all over the place mingling without masks, not keeping any social distancing, not adhering to any of the preventative measures that we've spoken about. And unfortunately, some of these people are unvaccinated. So they are going to get infected if that's going to be their behavior. And therefore, we'll continue to see the spread. So unless we start taking precautions and unless we work together, we are going to see the virus continuing to spread.
Okay, Minister, as we are on the Magro issue, there is a picture circulating on social media again about another family who is said to have, was preparing to walk their dead relative to the cemetery again. This is days after the father had to fetch his son to the cemetery. What can you say about that incident or this latest report?
Well, the information I have differ from what you're stating. And that is, as far as I'm aware, yesterday, this particular person had a post-mortem done. We had to fly in the pathologist from Georgetown. The pathologist went in about 1:15, the plane landed. The post-mortem was done. That was completed around 2:15. And thereafter, the body was sent to the mortuary at Mabaruma Hospital. The body is still in the mortuary. And arrangements have been made. The family went to the town council, Mabaruma Town Council, and made arrangements for the tractor and trailer that is controlled by the town council for them to have access to that tractor and trailer. And my understanding is that the tractor and trailer would be made available to them today so that they can use that to transport the body to the cemetery. So whatever is being circulated is patently false. And I guess there are people out there who just like to spread rumors.
Okay, Dr. Anthony, thank you. That concludes today's COVID-19 update. Thank you for joining us.
Thank you very much.